Hi, my name is Jesse Ogle, a current psychiatric mental health nurse practitioner student at Eastern Kentucky University. During the courses NCS890 and 892, I have developed a project proposal exploiting cognitive behavioral therapy as an intervention for the treatment of depression in adults 18 years and older. As an illustration, I refined a poster board that briefly profiles my project proposal. You can follow each key point as I discuss it in this presentation. Substantial literature indicates that cognitive behavioral therapy, or CBT, is an effective psychosocial treatment for depression and anxiety disorders in primary care and other treatment settings. CBT is a type of psychotherapeutic treatment that helps people learn how to identify, change destructive or disturbing thought patterns that have a negative influence on behavior and emotions. It focuses on changing the automatic negative thoughts that can contribute to depression. These spontaneous and negative thoughts have a detrimental influence on the mood. Research on the effectiveness of CBT treatment can be summarized in a meta-analysis where numerous studies can be surveyed, combined, and effect sizes extrapolated. To enhance the intervention of CBT, psychiatric mental health nurse practitioners could incorporate a specific theoretical framework in which I'll discuss in the next section. According to Gene Watson, perhaps caring cannot survive unless it is upheld by a moral ideal in theory and practice, and unless it becomes a philosophical basis for nursing to fully actualize its ideology, knowledge, and practice of caring. This way of thinking led Gene Watson to develop her theory of human caring. She devised 7 core assumptions. 1. Caring can be demonstrated in practice interpersonally. 2. Caring consists of a carrot of factors that result in the satisfaction of certain human needs. 3. Caring promotes health and individual family growth. 4. Caring responses accept the patient, who they are now and what they will become. 5. A caring environment allows patients to feel more cared for. 6. The science of caring is complementary to the science of curing. And 7. The practice of caring is central to nursing. When applying Watson's theory to the depressed adult, the psychiatric mental health nurse practitioner is to understand the goals of the application. The practitioner must present the idea that compassion is part of one's soul. Positive actions in relationship with the client will stem from human altruistic values. The practitioner should consciously present while caring for the individual in a depressed state of mind. Developing a healthy and trusting relationship promotes a positive process in the whole person concept. Other application processes to promote this working theory are to integrate individual care plans, educate for self-awareness of their needs, and seek to better understand their own specific needs. In the depressed adult, this theory places emphasis on harmony, balance, and human dignity. Patients with depression often have an accompanied negative shame. The nurse practitioner that puts Watson's human caring theory into these individuals can eventually change the way these patients view themselves, dispelling any ashamed feelings they may have placed on themselves. Proper human dignity and self-worth are paramount to the healing process for these specific patients. The target population that this CBT intervention will affect is adults with depression. That being said, some ethical concerns pertaining to socially and culturally diverse populations should be taken into consideration. One way is to utilize a screening tool that would pertain to any participant, such as the PHQ-9 screening tool. Pamphlets in my future inpatient, outpatient depression clinic that discusses cognitive behavior therapy as an effective intervention will create an inquiry for said patients. Attached to it would be the PHQ-9 Patient Depression Questionnaire. I will begin CBT for depressed patients given twice weekly for a period no longer than 90 days. At the end of each month, I will evaluate progress. At the 90-day mark, I will devise a plan for maintenance. I will need to set up team meetings for overall success. Initial team meetings to roll out the project and discuss involvement and answering questions. Over the next 2 weeks, I will hold 3 meetings per week. Roles will be discussed and timeline implementation. A recorder or transcriber will take pertinent notes for brainstorming and project improvement. Once a tangible plan has been produced, a meeting will be held monthly to discuss successes, failures, wins, and improvements. Office personnel, such as a front desk clerk, will disseminate the PHQ-9. Community resources such as town hall functions, newspaper ads, and flyers for scheduled seminars will be utilized to secure population target and participants. Funds for project rollout and initial introduction to the program will be pulled from community health centers, online fundraising, nonprofit organizations, and health wellness grants. I will promote more timely decision making, which may help reduce risks and costs. Identification of conflict issues that may compromise sustainability is also especially important, as well as setting clear benchmarks for ongoing performance measurement. And lastly, I will evaluate outcomes, determine if desired outcomes are achieved according to their goals. It can be easy to correlate improvements experienced by a patient to project subjective outcome. Tracking progress over time is commanded to ensure effectiveness. Because outcomes measure the larger effect of my intervention has on a patient, these measurements will need to be tracked over time. I will pull accountable data from outcomes and review my intervention outcomes after completion to determine the actual impact it has had on my patient. An Excel-generated tool to measure outcome, not only for project processes, but participant success as well. This tool will measure tracking and analysis of data and participants to include participant needs, progress assessment, attendance monitoring, quality, costs, and stakeholder satisfaction. Untreated clinical depression affects one's moods, thoughts, feelings, behaviors, and physical health. Sometimes medications are not satisfactory to treatment. Research shows that CBT is the most effective form of treatment for those coping with depression. You'll see that I've added a Gantt chart to the poster board that displays a simplistic time outline of project initiation and start points. I hope you've enjoyed my presentation and consider cognitive behavioral therapy as a future intervention in your practice. Thank you.